the gentleman from Massachusetts, Mr. Neal.
Thank you. Under President Biden and with your department's leadership, Mr. Secretary, we've seen an increase in the number of Americans with insurance coverage, a reduction in out-of-pocket costs, and lowering insurance and drug costs due to both strengthening and the growth of the Affordable Care Act. Our legislative agenda on the Democratic side, including the Inflation Reduction Act, is prevailing. Today, more than 40 million Americans owe their health coverage to the Affordable Care Act. That's how important this law is. Just last week, the other side tipped their hand on some of their health care ideas. More of the same, allowing insurers to discriminate against patients with pre-existing conditions, including diabetes, shifting costs onto patients, and promoting tax accounts that benefit the wealthy. All of this instead of bolstering a law that is not only widely popular, but also what consumers want and need. That agenda would raise health care costs for families across the country. On average, Americans with coverage through exchanges have saved $800 this year thanks to the Inflation Reduction Act, and the other side would put those savings on the line, as we noted in this committee just recently. We still haven't seen a Republican budget plan. They want us to get to work on balancing a budget, but they won't show us their plan. Make no mistake, their proposals will have a hard time under the magnifying glass and standing up. They simply will punish the sick by making them foot higher bills. If going after workers isn't enough, many of these positions will go after seniors. One of the first bills to repeal the life-changing drug pricing provisions of the Inflation Reduction Act, they would remove the power to negotiate drug prices for Medicare, eliminating the cap on out-of-pocket costs and insulin. Had the insulin cap been in effect in 2020, more than 1.5 million Americans would have saved $500 that year, including free vaccines that will save the average American $70 as beneficiaries. I think we can agree they will attack family budgets through their plans. Finally, Mr. Secretary, let me take a note for a moment, by the way, to congratulate North Carolina on expanding Medicaid and the Affordable Care Act. A reminder that every child in Massachusetts has health insurance. 97% of the adults in Massachusetts have health insurance because of the ACA, and it polls regularly in the high 70 percentiles. But finally, you and I have spoken a number of times, Mr. Secretary, about surprise billing. Mr. Brady and I, the former ranking member, we know precisely what we intended with the language and the words that we chose. We have not only prevailed in this committee, we have prevailed on the floor of the House, on the floor of the Senate, and now in subsequent in court cases. I hope that these implementation issues will be consistent with what this committee intended, and much of the confusion and expense has been a result of a department that is not fulfilling the wishes of what the committee intended here on this legislation. We need a commitment to indicate that we will continue to expeditiously air these issues and do precisely what this committee intended when we marked this legislation up. We saw it on both sides as a huge accomplishment. And if you might, in the last 14 seconds, Mr. Secretary.
Yeah, and I know we'll talk about this more, but first I have to say thank you to you, Mr. Brady, and many of your colleagues who pushed this, because at the end of the day, we still have work to do to make it work right. To your point, what we can guarantee you is that Americans, as consumers of that health care service, as the patients, are taken out of the food fight between the provider who gave the care and the insurance company has to pay it. The most important thing you did was to make sure that as that fight continues, it's not patients who have to pay the price.
Recognize the